I'm Joe Halko, your host, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance. This month's episode is titled The NMC NCSS Pediatric Development Clinic. Wouldn't it be ideal if by addressing critical gaps in early interventions, easier access was provided to expert evaluations and coordinated community-based services, which would enable children with developmental disabilities to develop essential skills for lifelong success? Well, that day has arrived locally as Northwestern Medical Center and Northwestern Counseling and Support Services are collaborating to ensure timely clinical assessments and thorough follow-up care during crucial intervention stages, laying a strong foundation for enhanced developmental outcomes and better quality of life for subsequent generations. To discuss the NMC NCSS Pediatric Development Clinic in greater detail, I'm pleased to introduce this month's guest, Nicole Noel, Early Intervention Team Leader for the Parent-Child Center of NCSS, Katherine Shattuck, who is the nurse practitioner of inpatient pediatrics and the Pediatric Development Clinic of NMC, and Amy Duprat, Developmental Clinic Coordinator and Early Intervention for the Parent-Child Center of NCSS. I'd like to welcome all of you to the program this month.
Thank you.
So let's start with how did this innovative approach get started, and what was the driving force to get this pediatric development clinic launched?
Yes, so I started my career many moons ago in North Carolina in primary care and had a specialty focus in children with neurodevelopmental disorders. So did that for several years and then moved to Portland, Oregon, where I continued with the work with children with special needs. And about 2.5 years ago, I moved here to Vermont to help establish the inpatient pediatric unit at Northwestern Medical Center. And that first year that I was here, it was a really rough winter, lots of kids with RSV. And so in the middle of the night when kids are having difficulty breathing and you're like so tired you can hardly think straight, I would have these conversations with parents about how was daycare going, how was school going. And inevitably, at least twice a week, I would hear stories about how there were concerns about a developmental delay, possibly autism, and somebody had put them on a list somewhere, and it could be, 18 months, 2 years that people had been waiting.
Yeah.
And so, as we kind of moved through the winter and got that under our belts, decided to start having conversations with our hospital administrators, local primary care offices, as well as just kind of stakeholders within the state to see where we were at with developmental services for children and how, with my background, I could kind of help out and get more kids served.
That is terrific, and you have certainly had some great experiences because you've been in different regions of the country. You've been able to kind of pull from what seems to be best practices from various portions, I would imagine, as well.
Yes.
So that's terrific, Katie.
Yeah, and we tried to start thinking about how we could start a clinic here with collaborating with community partners, what was already being offered in the community. So through our hospital administration, Colleen Moran, who is the the pediatric medical director at Northwestern Medical Center, we started reaching out to NCSS and the early intervention providers to see how we could come together and really start to access kids for these services.
And what we were finding with our early intervention kiddos was they were sitting on wait lists. We were referring them to the very few providers that we had within our region, within the state, and kiddos were aging out of our birth to 3 programming and without a diagnosis, and were then later being maybe diagnosed a little bit later on, and then having to then come back in and regroup on those services and stuff. And so we were realizing that we needed to get these evaluations completed earlier in the process, so we could wrap kiddos and families in those services, those needed services, to help hand off to those, ongoing services as they transition to school-based and other community services. And there was also, there's a shortage across the state of pediatric providers, specialty providers, and so that was another gap that we were trying to fill, is how do we get, how do we provide speech therapy, occupational therapy, nutrition services, and all of that for these, for kiddos that were really needing this service.
So we got the green light from hospital administration. We were able to access some funding, both through the state, through Building Bright Futures. And for a while there, when we started back in September, so almost a year ago now, it was just me and Nikki kind of just seeing what we could do and reaching as many patients as we could. And then fortunately, over time, we've been able to increase our services and offer a wider range of services to children in need.
And, speaking of who we serve, in totality, who does the clinic serve? What is the range and...
Yeah, so initially we started out really trying to focus on children under 5, because that was a big push through the state to have increased access for autism assessments for children in that age range. So that's where we started, and we very quickly discovered that there was a significant need for children over the age of 5 as well. Kids would come in, they would get their evaluations, and then parents would call back and say, that was wonderful, we're so thankful, but I have an 8-year-old, and can you see them too? And so decided that maybe we could open up and see older kids, and then really try to look at, can we add on additional services to really have a thorough evaluation that is following the parameters set out by the American Academy of Pediatrics as to what a in-depth autism evaluation looks like. And so starting back in January, we started adding on people. So we added on speech therapy services for speech evals, occupational therapy to do occupational services, and then collaborating throughout the community to increase access to feeding services and nutrition. And then over the summer, we added on psychology. And so I think Amy can share a little bit more about what the day-to-day assessment looks like. But right now we're open to any child. Usually about 18 months is when we can really start to talk about autism, and then all the way up to 22.
Yeah, and so the way our evaluation process looks like is that we've been able to divide our evaluations into two different days depending on the child's age. So we can make sure that we're providing evaluations that are appropriate for the child. So for our younger kiddos, who we have defined as 5, not yet in school, meaning engaged in kindergarten services, we do a 3 to 4 hour evaluation. So again, this is a comprehensive evaluation that we implement an autism-specific evaluation as well as a full developmental assessment. So this is about a 3 to 4 hour visit for the kiddo. Our older, the older kids that come in, who we have now identified as a child who is 5 and engage in kindergarten or school services and older, they come in for a full day. So what that looks like is they're also getting the autism-specific evaluation as well as the full developmental assessment, but they're also seeing our psychologist for a cognitive testing. They're also seeing our speech therapy for speech evaluation and our occupational therapist for an OT evaluation. So again, that full comprehensive evaluation so that to determine a diagnosis or not.
So that really sort of entails all the various services that are being offered by the clinic?
So that's the assessment days.
Excuse me.
We're also able to provide ongoing management for kids that are seen through our clinic. So they will come and see me for follow-up appointments to kind of get an idea of how they're going. Are there any new concerns? We know that children with developmental delays often have issues with toileting, sleeping, eating. So we're making sure that we're addressing all of those things on an ongoing basis because we know needs change over time. And then we're also able to offer ongoing speech therapy treatments as well as occupational therapy treatments, nutrition services, and then through Amy and some of the other staff were able to attend IEP meetings, really help with that partnership through the community. So if the school, if there are home health services, if there are behavioral health needs, that we're able to connect all those pieces and really serve as a point person so that anything that's kind of around that developmental concern, that we're able to address all of those needs, no matter where the child is on kind of the spectrum or their age, that we're able to kind of serve what the family needs.
Yeah, and since we're connected closely to NCSS, we are able to, again, collaborate the agency and the hospital to determine what's appropriate for the child and who their contact is. So we're able to, having that connection is been really amazing. Yeah.
Oh, that is terrific.
Yeah.
How does the collaboration between NMC and NCSS make the clinic meaningful by addressing the critical gaps in early interventions for families that are impacted by developmental disabilities, and as Katie has said, certainly autism being one of the leaders?
So, go ahead. Oh, okay. So there are a lot of, like you said, the collaboration is happening. So there's a lot of coordination between the two agencies as well as reaching out to other supports within our region. So Amy still attends some of our team meetings to talk about kiddos that are dually enrolled, that are enrolled and still receiving EI services, as well as other services that throughout the agency, throughout NCSS. So we have kiddos that may have aged out but are still accessing the resource team, early childhood support, and doing those care coordination efforts in who's providing what services, where are those gaps, where are the referrals that need to happen, and pulling in other community partners that may need to be a part of the child's team. And also, we've needed, like I said, there's been a need for additional occupational therapy services within our region and in our age group, and so that's been a huge benefit, additional speech therapy and feeding therapies and stuff. So it's really been a team effort to pull these services together amongst multiple providers and agencies.
Yeah, and I think it's important that and you've touched on it, that people understand that the individual is there at the clinic, and NCSS and NMC are working together, but there are those instances where you are pulling in other community partners in an effort to try to ensure success. And I know that each and every situation is different. If you could just speak to the facts so that parents understand that, all of you understand that, each case is very individual and different, and that the expertise that's being provided is being provided specifically for that young person.
Yeah, so every child that comes through, both that child and their family, are treated kind of as an individual. We have, certain questions and assessments that we use kind of universally, but when we make a plan of care, that's tailored individually to each individual child and what that child needs, and also what's the priority for that family. And then once that's been discussed, then through that collaboration with NCSS, we're then able to provide continuity of care. So if they have already accessed early intervention services, then after our evaluation, we're able to then connect with their early intervention team to say, this is what we found. Here's a copy of our report, as long as the family is okay with that being shared and has signed a release. And then we're able to collaborate and say, these are the services that early intervention is going to provide, and does that need to change at all based on the assessment, or what are services that we can provide that maybe early intervention doesn't have access to at that point in time, that we can kind of serve to fill in that gap. Even older children that have aged out of the early intervention services, we're able to connect and collaborate after the fact if they need behavioral health services, to find a behavioral health support person through NCSS or any of the numerous kind of programs. I think just recently we had a patient that was getting support through the parent as teachers. And so there are these other resources that NCSS provides that we are then able to kind of do warm handoffs and be able to have that close-knit collaboration so that things don't get overlooked or missed, or that we're not solely relying on the family to have to cobble everything together.
Yeah, I think that's important, and I'm glad you're expressing this, because I think so many times parents may feel, well, first of all, they may not know where to turn first. But even once they do, that maybe everything has to happen through that particular organization. That's certainly not the case. And the best case is when there is collaboration of people with expertise that can help that child to success.
And even if it's not, solely related to the developmental issue, we do have families that might need support for kind of financial support or transportation support or housing. And so those are things that we, if that's the priority, if that's the need at this point in time, we want to make sure that we're connecting with the right place to get that need met, whatever it is.
Yeah, and we've had many families share, they do have like a point person, and it's just like they need the reminder, or they just need that extra support. And so when we're able to make those connections for families, it's very helpful. It can be very overwhelming for family going either through this process or having multiple people involved in their child's care. We had a family in yesterday that was just so thankful that, they had options, that they had multiple people to have this conversation with. It's not just one, or didn't have access to a service. It was like, wow, we have these options, and what's best for our child now. And so it's been a blessing, really. Families have shared multiple times. Just again, closing loops and closing those gaps is so important, because again, when you have a child that has many needs, it can be very overwhelming, and to have a lot of people, it's just nice to have people that are there for support and that can help navigate the road ahead of them. So, yeah.
Yeah. Because as much as we would hope it's a simplistic system, it's
it's
complex,
not.
very complex,
Yeah.
and can just, people can just feel there's nowhere to turn.
And so when we're reaching out over at NMC, it's who is already involved. So we're not we're not another person getting involved. We're just making sure that nothing was missed, or we've had conversation with a family and, hey, I just want to let you know. So it's been really nice.
Yeah, we're not duplicating
No,
services.
exactly.
It's supposed to be additive.
Yeah.
Like if you're already well connected, then how can we add to that? And are there other things that might need to be accessed, or are you all set and we just need to make sure that continues?
And that is so critical on the not duplicating services and everybody bringing their expertise to the table, so to speak, and maximizing the resources that we do have, because as all of you have expressed, I mean, it's been a long time, I think, since everybody has been fully staffed.
Right.
And you try to do the best that you can with the number of staff that you do have. And, I mean, you're always looking to increase staff in certain areas. And let's face it, some positions are much more difficult to fill than others because of the particular licensures or certifications that are required for that position. But the one thing that is very encouraging, though, here in this community is the fact that we do have all this collaboration going on as a matter of course. It's not like it's being forced on somebody. And I think that's critical. And like I said, I think if we were to look around the entire state of Vermont, that would not be the case. So I commend all of you for the work that you're doing.
Yeah, and not to mention the evaluation timeline is the access to getting seen is shorter, and which is huge. Going back to the clinic, it's For a parent to say they have to wait 2 to 3 years for
Oh,
their child
yeah,
to be
yeah.
evaluated can be devastating for
Absolutely.
most, so.
Yeah, absolutely. So, what are the long-term goals and the outcomes for the clinic to ensure sustainability?
Yeah, so with long-term goals, we always have, pie in the sky dreams. So, feasible dreams are to have it be a sustainable clinic, which we've done our due diligence to make sure that everything we do has an eye towards sustainability, because we don't want to start a service and then not be able to keep that going and leave families in a lurch. So that's why we've been very thoughtful and methodical about how we increase and how we expand, and not going too big too fast, but also sticking to some of our tenets of really trying to keep wait times down, because if you have a 2-year-old and they're not talking, having them wait 18 months for an assessment, that's another, that's a whole nother lifetime.
Sure, right,
And so we're
right.
trying to keep those wait times to a minimum, which so far we have succeeded in doing. I think the next step would be to continue to increase our occupational and speech therapy services, because as we see more children, then we continue to have more children that want to access ongoing therapy services. And so to try to have that be also something that families don't have to wait for, would also like to add on physical therapy, because that is something that, we do see kids that toe walk or that have gross motor delays. And so we would like to be able to add some services for that, or some real-time evaluations that can happen as needed. We will be increasing our psychology time to add more services to that, just getting kids in that need that testing. In terms of expanding the kind of the base of who we see, right now we've kind of been focused on, is there a question of autism? The goal is to open that up to, is there any sort of academic or developmental concern, not necessarily specific to autism,
Right,
but is
yeah.
there a delay of some sort that we need to address? And as a nod to that, we have opened up our clinic to infants that have been born with in utero exposures to substances, because we know they are at a higher risk for developmental delays. And so in other hospitals, kids have access to NeoMed, so kind of like a follow-up clinic in which they would be seen on an ongoing service to look at those developmental skills. And so that's what we are going to start offering for those infants that are born at Northwestern Medical Center. And potentially kids in our area that may have been born at a different hospital,
Sure.
but still kind of fall into that category. If their primary care provider sends a referral, that we'll be able to follow them on a 3 to 4 month basis to really have an in-depth look at their developmental skills to make sure everything's on track. And if there are any concerns, to catch that early, because we know early services lead to better long-term outcomes.
Yeah. That's one of the great things about this whole initiative, is the earlier the better. And it sounds like, you've been able to really put a dent in those wait times that unfortunately some
Yes.
parents have had to endure over time.
That was definitely, I think that was the driving force to begin with. And then as the clinic took off, and like Katie said, when it was the two of us doing evaluations, then it was quickly realized that we need more. There's definitely a need for much more services and much more wrap around for families and stuff. And so the clinic has definitely expanded pretty quickly to meet those needs. And so it's been really it's been great. And I will say I have heard from other community partners from the past that have been part of other similar clinics like this, and we're really impressed with how quickly we were able to get this this initiative off the ground and running and being successful, and really combating those wait times and getting kids seen and getting those services in place and families connected. And so it's been really gratifying to know that we've really made an impact on our local community in such a way, in such a short amount of time.
Yeah, I can't say enough about just how, amazed, impressed that I have been with like I had this crazy idea, and so to have this crazy idea and then take it to like Dr. Moran and be able, like, hey, can we do this? And then, then we go to the hospital administration and say, I think we have this idea that could work.
Yeah.
And then, like, everybody that we've gone to has just been so supportive and has really, because everybody knows somebody that has a kid that has a
Sure.
need.
Yeah.
And so
Yeah.
just the outpouring of support down to when we were trying to get everything started because we were going to start seeing our patients. The maintenance crew at the hospital on their own time were going out and getting like kid-friendly light switches that would dim because the lights would be too bright in there, and getting like the child safety locks. So, even down to the support people, it's just been so, the wraparound on getting this clinic going and keeping it supported has been amazing. The partnership with NCSS has been great. The local schools have been, outpouring of just gratitude, daycares, primary care providers,
Sure,
so
yeah.
it has been, when we talk about grassroots, like just everybody in the community coming together to really support this has just been refreshing to see.
Yeah, terrific. Now, any final thoughts from you on how this partnership between NMC and NCSS is not only a win in improving the lives of children with developmental disabilities, but as we've been saying, looking to the future and what it can mean. So any final thoughts you'd like to share?
I would just like, I feel like we're kind of a role model for the rest of the state and other regions. And we have, as part of the early intervention in our region, other parts of the state have reached out to say, hey, how did you get this off the ground? How did, and wanting to know, like, how can we maybe bring this back to our community and build something similar? And so I feel like that's kind of where we are at, is really just kind of showing how quickly things can move when you really work together. And it takes a village to raise a child. It takes a village to raise this wonderful program. So,
And that's great to be able to share that statewide, and you would really hope that over time, every region will have a program like this. And that certainly may happen, and hopefully sooner rather than later for Vermonters who are living around the state. So,
yeah.
again, I think that's great that you're sharing all of that information with other organizations around the state of Vermont. So, believe it or not, our time is up, and I do want to thank my guests, Nicole Noel, Katherine Shattuck, and Amy Duprat, for sharing their insights on the NMC NCSS Pediatric Development Clinic by addressing critical gaps in early interventions for families impacted by developmental disabilities like autism. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.